Hello and welcome to this Lancet moment. Today we are discussing thrombosis, and with me in studio we have Dr. Emma Wypkema. Thank you for joining us, Doctor.
Thank you, Diasha. Thank you for having me.
Who is at risk of acquiring thrombosis?
Well, there are really one could divide them into two large groups. The group where one has an acquired problem or an inherited problem.
Okay.
Now, amongst the things that one may acquire as a risk factor for thrombosis are, for example, as we age, we become at greater and greater risk as we grow older. Obesity and immobility obviously would predispose one to thrombosis. Any trauma or surgery balances that whole very delicate coagulation system towards thrombosis. So thrombotic problems are often complications of surgery or people that have been in motor vehicle accidents, etc. Inflammatory conditions may also predispose to thrombosis. And in our environment, where HIV is so prevalent, HIV most certainly is associated with a much higher incidence of thrombotic disorders, as are in many of the inflammatory conditions and some of the autoimmune disorders as well. Certain drugs in our situation, like the pill, and pregnancy predispose to thrombosis, and there again, it's a physiological mechanism whereby the body, trying to preserve the fetus, prevents bleeding and balances the whole coagulation system towards thrombosis. So thrombosis is much more common in pregnancy, and obviously with the manipulation of hormones with a pill also predisposes one to thrombosis. Malignancies predispose to thrombosis by the release of certain tissue factors that actually activate the coagulation system, and also particularly in hematological malignancies like the myeloproliferative disorders, where one gets abnormal platelet function, etc., that would predispose to thrombotic problems. Then, of course, any heart unusual rhythms, abnormal rhythms, atrial fibrillation, which is very common, can predispose to thrombosis in the heart, and those emboli then can go to the brain and cause a stroke, a very common cause of stroke. And heart valve surgery, obviously a foreign material within the heart, may predispose to thrombotic problems. So that's just sort of a broad outline. And then there's the group that are inherited, and we now know in the last 30 years or so, 35 years, we have slowly identified more and more inherited conditions that would predispose to thrombotic disorders. And in fact, they're fairly prevalent because they must have conferred a survival advantage previously, because obviously people that bled less were less likely to die. And if one had a inherited factor that balanced your whole coagulation system more towards the thrombotic side, that would be advantageous. We see quite a lot of inherited thrombotic problems, but nowadays it's a problem because in the last century we've started doing more surgery, so we're seeing more thrombosis because of these things. We're obviously using the pill, we're seeing more thrombosis because of that, and these inherited thrombotic problems play a role.
Dr. Emma, thank you so much for joining us today and sharing on this topic. If you want to know more, you can head over to www.lancet.co.za. Thank you for watching, and join us next time.